Hi, I'm Dr. Justin Greenslade, an upper gastrointestinal and bariatric surgeon based in Brisbane. I'd like to talk to you about the various weight loss surgeries that are available, and in particular, compare and contrast these procedures to see which one might best suit your purposes. The three surgeries that I offer for weight loss are the sleeve gastrectomy, the single anastomosis gastric bypass, and the Roux-en-Y gastric bypass. The sleeve gastrectomy is the simplest of these procedures. This involves the removal of the outer part of the stomach to turn the stomach from a sac-like structure into more of a tubular structure, hence containing portion sizes each time you eat and reducing overall intake. It does trigger changes at a gut hormone level, which helps with appetite control. This operation remains the commonest of the procedures that we do, and I find it works particularly well for men, particularly young men. They seem to get the best result from this surgery of all. Others are drawn to this operation because of its simplicity, and it has to be said that probably is the lowest risk operation of the ones that we do, simply because there's fewer steps involved in the operation. The next operation in terms of complexity is the single anastomosis gastric bypass. This operation involves the creation of a long gastric pouch separated from the rest of the stomach with a stapling device. Again, this is aimed at controlling portion sizes. But in this case, a long loop of small bowel is drawn up and joined to the bottom of that pouch, so the food will pass straight into the next part of the bowel, skipping past the rest of the stomach and the duodenum. It therefore has a second mechanism of weight loss with the diversion of the food stream away from the rest of the stomach. This probably adds about 10 or 15% to the weight loss effect. It does require careful attention to vitamin supplementation afterwards, and we do strongly suggest having allied health support, including dietitian support with these operations. The next operation is the Roux-en-Y gastric bypass. This is the operation that's been around the longest of all, over 55 years now. This operation again involves the creation of a gastric pouch with the stapling device, bringing bowel up and joining it on to the bottom of that pouch, but also a second join further downstream, which allows the digestive juices and bile to join up with the food stream. This operation can have particular effectiveness for people who have severe reflux and are dependent on medication to cut acid levels down. This operation will divert bile and acid further down the bowel, so it doesn't tend to creep back up to bother the esophagus anymore. However, compared to the single anastomosis gastric bypass, there does seem to be a lower chance of problems like grumbling, left-sided abdominal pain, and the potential for bowel obstructions further down the track. So in short, if you're looking for the simplest procedure, the sleeve gastrectomies would certainly meet that criteria. But if you're looking for some greater potency and durability, then perhaps one of the bypass procedures are worth considering. Of those, if you suffer from severe reflux, then I'd have to say the Roux-en-Y gastric bypass would be the choice. But if not, the single anastomosis bypass would be a suitable alternative. If you wish to come and discuss these alternatives in further detail with me, I'd be very happy to meet you and go through your options. Thank you very much.